Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is on coronary artery disease with a normal cholesterol level. Coronary artery disease when you have a normal cholesterol. And the reason for this topic today is because of an encounter I had with a patient yesterday who was seen in follow-up for having had a heart attack. And when he went into the hospital, his cholesterol levels were normal. And so he was surprised because he'd had cholesterol levels done in the past and they'd looked good, and he thought he was in fine shape. I really hadn't seen this patient very regularly until after his heart attack. But he wanted to know how could he have developed coronary disease with when his cholesterol levels were so good. And so we had a bit of a talk about that. And the point that I wanted to share with you is that a lot of people, in fact, the majority of people who have heart attacks don't have significantly elevated cholesterol levels. So a little known fact is that cholesterol doesn't correlate well with the major thing that correlates with coronary artery disease. And that thing that correlates most with coronary artery disease is coronary calcification. So calcification of the coronary arteries is the factor that correlates the most with developing coronary disease. And there are several things that contribute to coronary calcification, but cholesterol isn't one of the big ones. It's no more likely to be present in an elevated level with people with coronary calcification than anything else. It doesn't correlate. Cholesterol doesn't correlate at all with that particular variable, which is the most significant issue when it comes to coronary disease. So what does correlate with coronary calcification? Well, the main thing is insulin resistance, which is where the body becomes resistant to its own insulin. Insulin levels rise, inflammation goes up, and increases the damage to soft tissue, including the arteries, and then that leads to calcification of the arteries when calcium is available, as it is in many people who are deficient in vitamin K2. So I want to share some numbers with you with this patient, and just to give some perspective, his total cholesterol was 178. His LDL was 110, his triglycerides were 103, and his HDL was 47. His ratio of the total to HDL was 3.8, which this is considered very good. If somebody has these kind of numbers, you can tell them your risk of coronary disease is low. That is, if you're following the usual cholesterol guidelines for trying to understand coronary disease. Now, it's not that cholesterol doesn't have anything to do with blockages that develop in the coronaries. Of course it does. But the cholesterol basically becomes part of the blockages because of this other process of inflammation that's going on in the coronary disease or coronary arteries. So heart doctors primarily focus on just trying to get that cholesterol as low as possible so that when there is inflammation going on, there's just less cholesterol to plug up the arteries in the first place. But I prefer to focus on decreasing the inflammation, because if you wipe out the body's cholesterol, you're taking away from your body some really critical nutrients that it needs for all sorts of things, including making your hormones, making your brain healthy. A fourth of the cholesterol that's in your body is sitting in your brain, and your brain cells need cholesterol to function well. So what other things might have contributed to this person's coronary disease in addition to his apparent insulin resistance? First of all, before we go on to that, usually you can deduce insulin resistance by the ratio of the triglyceride to the HDL. In this case, his ratio isn't too bad. The ideal is 2, but his wasn't too bad. But that doesn't always hold true. And one way that you know that somebody is in insulin resistance is that they have extra fat hanging over their belt, and he did. So he also had some other things, though, that were clues to inflammation going on in the arteries. The first thing is that his vitamin D was real low. So vitamin D is protective against coronary disease, And so is vitamin K2, which we cannot measure easily, but we can measure D easily. And a lot of people are very deficient in D, as this patient was, and so he basically was missing one of his protections, and he was very deficient in K2 based on history, so he was missing that one. His uric acid was elevated, 8.2. He's in the gout range, and that is a signal that he was in insulin resistance. And finally, his homocysteine was elevated significantly. Now, homocysteine has been known to be a risk factor for coronary disease for decades, but it's ignored by most doctors because the research supposedly showed that lowering the homocysteine didn't make any difference. Well, I believe that research was poorly done. I'm just not going to go into a lot of detail, but there is now increasing evidence that homocysteine plays a significant risk in developing dementia. And even though the heart doctors aren't paying attention to homocysteine, the neurologists are, because they are worried about their patients getting Alzheimer's disease. And so they are focusing on lowering the homocysteine, as I have for many, many decades. Homocysteine is easy to lower when you add the right nutrients in. But the point is, this patient had multiple other issues going on that were risk factors. So he had 4 major risk factors: insulin resistance based on his gut hanging over his belly, or his gut hanging over his belt. He had an elevated uric acid. He had a low vitamin D level, probably had a very low vitamin K2 level. So he's got all of these inflammatory things going on that are what are causing his coronary arteries to get inflamed and to get blocked. Now, if we just pay attention to lowering his cholesterol, guess what's going to happen? He's going to have another heart attack. Now, it might take a while, but he is going to have another heart attack down the road. And so it's critical to pay attention to all these other risk factors that are playing a role in inflammation of the coronary arteries, as I'm sure is going on in this case. So I hope you found this information helpful in understanding how in the world do you get heart disease when you've got really good cholesterol levels. I wish you well, God bless, and have a great day.